All right, man. Like, I know we talked privately before, but still, like, can you introduce yourself for the audience?
Absolutely. So I'm Jonathan Gardner. I'm a doctor of physical therapy and a strength and conditioning coach with the Charlotte Hornets currently. Previously to that, I was, in the private practice general outpatient setting in the Maryland, DC-ish area. I was there for 5 years, sort of, ran the gambit from basic staff PT all the way up to being a regional director by the time I finished up. And then came to Charlotte. We just finished my second year here. So looking forward to a third. So yeah, that's kind of me in a nutshell.
Nice, nice. So, um, what is it's gonna be a lot different, but like, what is the main difference between working at private sector, and like work at a pro sector?
Sure. So I think obviously with the private sector, like there's a lot more depth and breadth in terms of like what you see, right? So I'm seeing athletes from across different sports. I'm seeing Gen Pop. I'm seeing injuries and pathologies from head to toe. Whereas obviously once you get into a professional sport, some of that stuff sort of narrows down, right? So I think it's become a little bit more hyper focused in terms of, again, there's just natural pathologies you're going to kind of see in the basketball realm that you're going to see more of as opposed to cervical radiculopathy or labor repairs in the shoulder and stuff like that. So I think that's probably been the biggest difference. And then obviously, as opposed to seeing a patient, if you're lucky, 2 or 3 times a week, these guys have the pleasure of seeing me 7 days a week, whether they want to or not, right? So it's a little bit different in that regard. And then there's the obvious time constraint, time crunch that comes along with an 82 game season, right? Like you're trying to maximize time and not steal time from the sport, but also make sure that these guys are getting what they need on a rehab and performance front. So again, probably spending less individual time with certain players as they sort of navigate the continuum of performance versus rehab versus playing versus not kind of stuff. So those are probably the biggest differences.
Nice. So, um, working with basketball player right now, what is like the most common injury you have to deal with?
Um, I mean, I think ankle sprains are probably high up there. I mean, it's either ankle sprains or just some of that chronic patellar tendinopathy, anterior knee pain type stuff. So I mean, I'd say those are definitely the. I think if you kind of do an analysis of the league, I would assume that ankle sprains are probably your leading injury for time lost. Um, so that's certainly an area of focus I think for everybody in the league at this point.
Yeah. So, um, for ankle sprain, like
Mm-hmm.
I think there's like really not anything we can do to like prevent that, since like
Sure.
you don't know when are they gonna step on others people's shoes or like
Mm-hmm.
that. So, the rehab part of the ankle sprain is probably like really important, right?
Mm-hmm.
So, can you like walk me through, like, usually if it's like, I know that like there's different type of ankle sprains, so like, can you like explain a little bit about that?
Sure. So I mean, if we're just looking at sort of general ankle sprain mechanisms and stuff like that, I mean, the most common you're going to see is that inversion sprain, right? It's going to affect those lateral structures normally, ATFL, CFL. Occasionally, you'll get some of that. Um, you'll get that deltoid ligament sprain with more of an eversion mechanism. Probably not as it's obviously not as common. And then you've got high ankle sprain type stuff where you're affecting more of the syndesmosis and that sort of thing. So those would be the three types. Obviously, for us, again, the most common would be that lateral ankle sprain. Um, from a prevention standpoint, kind of like you talked about, again, there's not the way I explain it to guys is that there's not an exercise you and I can do that's going to prevent you from stepping on a guy's foot, right? So I think there are preventative measures you can kind of put in place to sort of dull the impact of what's going on there, whether that's a taping method or a bracing method, and then just general ankle foot maintenance kind of stuff. But again, if a guy jumps 40 inches in the air and comes down on a center's foot in the middle of the lane, I don't know how much we're going to do there, but hopefully some of those things sort of again lessen the severity of injury there.
Nice, nice. So you also brought up like taping,
Mm-hmm.
and I know there's kind of a debate about like taping the athlete's ankle, right? Probably they should have more mobility, but if tape the ankle, that means like it's more rigid. There's not a lot of mobility there. What are your thoughts on like taping the ankle?
Sure. So for me, I mean, again, I'm PT by nature, right? So I'm not the taping expert. I leave a lot of that to my excellent athletic training colleagues. I think taping or bracing at the end of the day, right? Like you're stabilizing something, but then you've got to give up motion somewhere else. So again, that's sort of the debate, right? It's like, okay, so if I lock the ankle down and don't let it move, am I increasing risk for midfoot stuff? Am I increasing risk for some high ankle stuff or something traveling up the shaft of the tibia and stuff like that? So I mean, it's a catch 22 plus minus sort of thing where again a lot of that stuff I personally will leave up to players. I know I do recommend for any of our guys that have chronic ankle instability, right? Like we sort of recommend some sort of bracing technique because at the end of the day, like if you don't have those ligaments on the outside, those passive constraints for your ankle, like you're more susceptible to risk. So on top of obviously the training and the rehab side of things, I do think with more of those chronic things that giving them some sort of external support is important. It's just understanding that there's a give and take there as sort of lock, for lack of a better word, lock some motion down that your body's probably going to find it somewhere else, or again force is going to be transmitted a little differently. So it's just keeping that stuff in mind along with player preference as well.
Nice, nice. So I also noticed that after an ankle sprain, like people will or like physical therapists, athletic trainer, coaches, sometimes they'll try to like add in like barefoot training, toe
Mm-hmm.
training, those kind of stuff. Uh, like I think it's kind of popular for years, right? So, uh, can you like give us your thought about like barefoot training, like big
Sure.
toe training, those stuff?
Right. So again, I think it all sort of falls on a continuum and stuff like that, and it's looking at guys' foot structure and just general intrinsic foot strength and ankle strength and stuff like that, and figuring out if removing the shoe and potentially even the sock as well allows you to access more of that relative motion that you're going to look to sort of restore after an ankle sprain. Because again, the biggest thing you're going to run into more often than not is a loss in dorsiflexion, right? So it's figuring out where that's coming from. Like if they're getting enough tibia movement, but they're not getting enough pronation and sort of yielding in the midfoot and forefoot, like if you got a shoe on, it may be hard to kind of see that stuff, right? So for me, more so, I'm probably taking the shoe and sock off more from an evaluation standpoint, and then sort of seeing how the foot and ankle moves there, and then sort of progressing or regressing as we sort of need to. I mean, there's a big push for the barefoot training. Again, it's the quote unquote natural way to train, but at the same time, these guys play in shoes, so you don't want them just strengthening barefoot when at the end of the day they are going to be in particularly a very specific model of shoe, right? Like guys have got a shoe deal. Um, he has to wear these certain type of shoes, so it's understanding how the foot and ankle sort of respond in those environments as well. In terms of, I mean, I think I would trend more towards just making sure that we're doing some sort of intrinsic foot muscular training. Again, that can be, it's inevitably going to be barefoot, but in terms of like, am I trying to do specific stuff in the weight room without shoes on? Again, sometimes that's player preference, and then sometimes it's more so for me from that evaluation standpoint, just to see how all of the intricate parts of that foot and ankle complex sort of articulate together.
Cool. So, I know like sometimes because I suffer like ankle sprain a lot. I play basketball. I suffer from
Mm-hmm.
ankle sprain a lot. And then sometimes like after ankle sprain, I'm gonna feel like Achilles tendon tightness. Why is
Sure.
that?
Again, I think some of that may just be loss of, that relative dorsiflexion sort of motion. I mean, the other thing too is as you have some swelling and inflammation in through there, and depending on, just how the joint sort of responds. I mean, you could even get some posterior impingement type stuff that sort of presents as that like distal Achilles type pain. The other thing too can just be you've again lost that range of motion. You've probably offloaded the limb for a little bit. So depending on, again, if you have underlying pathology there in the Achilles that you may not have known previously, as you sort of get it back moving, that tissue may just be a little more sensitive, sort of thing. So again, I think for me, having some sort of baseline, and again, that's hopefully something that I'm able to sort of do a better job of moving forward now that I've kind of got my foothold here is making sure that we do have these baseline assessments for ankle health, right? So it's getting these guys on our isokinetic machine and getting max eversion torque and getting max inversion torque, and then putting them on a force plate and get a soleus push, and then as best we can do it, a gastroc push, and sort of, again, I think collecting data in this realm is super important, but if you don't have the baseline behind it, it's not going to tell you a whole lot. So trying to get that when these guys are quote unquote healthy, um, I think is super duper important for anything you're going to do from a rehab front to a performance front.
Another question about this is like these guys play basketball for like years, their whole life.
Right.
Their ankle like really ever healthy?
Um, Again, I think that's incredibly player specific, right? Like we've had a couple guys in the last couple of years have their first ankle sprains ever, right? So some of that's again, they're I'm not going to say it's purely luck, but there's a decent amount of luck involved in whether or not you land on the guy's foot, right? So um, understanding that aspect of it. But in terms of like, again, you're probably speaking more to like just the general degeneration and wear and tear kind of stuff. Again, healthy's a spectrum. I think Corey Schlesinger used to be with the Suns, now with Texas, right? Like he spoke about it a lot. He was like, high performance sport isn't quote unquote healthy, right? Like these guys are redlining, going maximum effort again for 82 games. Plus you add in playoffs, you add in preseason, you add in everything they're doing in the off season and stuff like that. So again, I think it's finding a way to sort of manage all of that load and wear and tear, while understanding that like there is going to be some give and take there because of the nature of the sport.
So no, I think no matter strength coaches or like physical therapists in the league, I think that the hardest part is like managing the load, managing the stress, right?
Sure.
So, um, I know in strength train like strength training or like performance training, they kind of use like game day lift or like post game, pre game, or
Mm-hmm.
like the day after.
Mm-hmm.
Like in in your role, like physical therapist,
Mm-hmm.
do you see guys like usually see guys like pre-game, post-game, or like
So definitely pregame. I mean, we guys have optional treatment times pregame. Again, it's sort of up to them based on what they kind of need, and then whatever sort of routine we together sort of put in place for their pregame routine, is kind of what we go with. Postgame is very player specific. Again, I think we've sort of trended towards that. Again, Daniel Bove probably wasn't the first guy, but he's probably the most notable guy to kind of, sort of this stress consolidation stuff. So again, we do try to consolidate stress and have guys lift post game, particularly our higher usage guys. And again, it may be two blocks of exercises. It's not anything crazy high volume, but just making sure that we're getting that stimulus and then allowing that day after a game to be a quote unquote recovery day. From the PT side of stuff, again, for me, that's always going to vary on whether it's a long term rehab guy versus a short term. Um, Long term rehab guys that aren't playing, I'm obviously treating pre game, and then they're probably not doing anything post game because the focus is on the guys who are sort of accumulating game minutes and stuff like that. Short term rehab, again, I think it's finding a way to address these deficits with minimally effective dosing, both pregame and postgame kind of stuff. So again, whether that's me physically taking over some of that stuff in the weight room postgame, or if it's obviously I've had a great relationship with our strength coaches here and a lot of conversations about like, hey, this is your chronic ankle sprain guy, and just like add this stuff in post game and stuff, and we'll do some, eccentric eversion or put them on a slant forward to sort of train that stuff while they're fatigued and sort of things like that. So I think it's very player dependent, but for the most part, I'm seeing guys pregame, they're normally getting their lifts post game, and then it varies based on where they're at in the rehab process.
Cool, cool. So, uh, since it's pregame, like, I know it's like probably like player's preference on this, but like, do you, as a physical therapist, do you like use like corrective exercise or like kind of like muscle activation, those kind of stuff? Because
Mm-hmm.
I know like a lot of biomechanics, I think kind of don't believe in like muscle activation or like
Sure.
corrective exercise, those stuff. But just want to know like your thoughts. I know it's definitely player
Uh,
preference on your like elite athlete.
sure. So I think, like you said, player specific, and again, it's sort of what they need to get ready for a game, right? Like I have guys who they walk around amped up. So for us, pregame is a way to sort of almost calm them. Again, you're not trying to like shut them down and put them in nap mode, right? But again, you're trying to do what you can to sort of lessen some of that performance anxiety, whatever you want to call it, that general buzz before a game where they're just too amped up, right? So you'll see that end of the spectrum, and then I have guys that they want to get after it and they don't feel good unless they've done something heavy, fast, explosive in the weight room. If we're doing some hard contract, relax, PNF type stuff in the training room. Again, you've got guys who have these routines that they've done for 12 years that again I don't touch. We don't really do anything. They're like, oh no, I do this. It's like, okay, knock it out. It served you well so far. So again, I think it's very player specific. I trend more towards some sort of quote unquote muscle activation corrective type stuff, particularly for whatever sort of nagging injury history we may have, and then obviously sort of pinpoint stuff based on long term rehab type things. Because again, I think I operate more on the load tolerance force management side of things as opposed to like a manual therapy side of things. So again, like I'm happy to needle something that feels tight, or if a guy requests a Theragun, I'll Theragun, or do something with sort of fascia manipulation or joint mobilization, whatever the case may be. But at the end of the day, that tissue's got to tolerate load. So again, if it's doing some isometric or PNF or eccentrics or whatever the case may be to sort of dull that pain response, and again sort of get that nervousness and be like, no, 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 I can tolerate more load, I can tolerate more load, and sort of progress them from there. That's sort of the end of the spectrum, I would say. I kind of live on, particularly pregame.
Nice. Um, so I'm gonna dive into like more into like the foot and ankle. Okay.
Mm-hmm.
So I know like there's three arches, right? In the
Yeah.
foot. Yeah, and because I know like some coaches will say there's four, but I don't understand that. Like so three arches in the foot. Um, in terms of training those three arches, um, are we able like this is a weird question, but are we able to like specifically train one? And like is it like really need to like let's say if someone's flat-footed,
Mm-hmm.
do we really need to like put a lot of effort in it? Not specifically talking about basketball player, but more
Sure.
overall athletes.
Right. So again, can you isolate one arch versus another? I'm sure there are people out there that will tell you absolutely I can. Right. Like there's I think the one of the bigger things that's kind of shot around social media here, not necessarily super recently, but in the past, right? Is you see these feet guru who are like, no, get out of your shoes, splay your toes, always have tripod foot, this, that, and the third, and then somebody will respond with a picture of again LeBron's foot where his toes do not do that, and he's LeBron, and those feet guru are not, right? So I think it's understanding that it's always the continuum type thing, right? So I think for me, it's taking a look at guys' foot structure and understanding that regardless of whether they're super flat-footed and pronated or whether they're a very high arch, rigid and supinated, at the end of the day, you're looking for some way to get that foot some sort of movement and variability. Um, so again, I'll train for a flat-footed guy. Yeah, I'll do some stuff where I'm trying to get them to sort of engage that arch, that medial arch, and sort of try to lift that foot off the floor. Um, but again, it's understanding the consequence of doing that, right? Like if that's how their body's typically loaded, and then I have them hyper focused on trying to supinate and grab the floor again, does that place load somewhere else while they're doing certain exercises or whatever the case may be? So it's understanding that there's always that give and take there. But the biggest thing for me is trying to find some sort of movement variability. Like I want to see the foot pronate as they go into dorsiflexion, that tibial internally rotate, and then the opposite as they sort of plantar flex and stuff like that. And it's making sure that regardless of exercise choice that I'm doing, that I am getting load through the tissues that I want, right? So if I'm doing a calf raise, making sure that it's a calf raise, they're not rolling on the outside of their foot, that they're pushing through first MTP, and they're not compensating with like their flexor houses and stuff like that. So again, I'm looking more for the variability side of stuff, and again, that can be barefoot, that can be in shoes, that can be hyper focused on creating an arch, that can be hyper focused on pronating. It's whatever sort of bucket I think you need to fill for that athlete, and then understanding the give and take of fishing for different things.
Nice, nice. So LeBron's feed is probably like Instagram, Facebook, like a lot of people share that photo.
Of course, of
Yeah.
course.
So this also like this kind of like also brought up one of the memory that there's one time like me and my colleague was talking about like barefoot training, the arches, corrector exercise, all those stuff. Then the other day, like Adam, shout out to Adam, like he just sent me a because besides like basketball, I also work with track.
Sure.
So the other day, Adam just sent me like Fred Curley, another like
Yeah,
sub
yeah.
10 elite sprinter, and showed me like his foot is like, oh, like kind of sort of like LeBron, not that not
Sure.
as like then they're like, see, like that guy's like if we look like if we use the traditional like barefoot training foot structure, that feet's probably messed up. But that guy runs sub 10. So
Exactly. Exactly. So again, it's like, and again, you'll see those videos of like elite marathon runners, right? Like people are like, oh, like you can't let your foot collapse because it's going to take your knee. And these guys run 26.2 miles faster than I can run one, and their foot just dumps into the ground. And again, it's like, okay, again, it's obviously very task specific, and then it's very athlete specific in terms of how they're structured, right? So again, it's understanding that, yeah, after an ankle sprain, like I can do some joint mobilization type stuff to get the foot moving and to get the ankle moving a little bit better and regain some dorsiflexion. But in terms of, am I going to do these arch holds that all of a sudden are going to turn this nice flat foot into this perfectly arched foot? Like I just I don't really subscribe to that. And that's certainly not what I try to fish for on the rehab side of things. It's understanding that they have this inherent structure, and that, yeah, we may need to not necessarily compensate, but may need to modify around it so that they can load tissues that we want to. But at the end of the day, the structure is going to remain the structure.
Yeah. And for all those like feed guru, I guess, like they always say, oh, or like coaches say like your knee can't cave in, you need to have the arch, right? But if you look at the gait cycle, there's gonna be like there's gonna be foot pronation and then supination. You got to have the mobility to do both, right?
Mm-hmm.
So yeah, I guess like what I'm saying is like I agree with your approach that like variety probably is the best,
Mm-hmm.
right? So besides like or for like in your experience with elite athlete and with like the season, do you ever encounter guys like they want to do this thing today and then do another thing like the other day?
Sure. So again, some of that stuff is understanding that there's the time constraint, there's athlete preference, and that sort of thing in terms of what you're programming or giving them to do. And it's understanding that at the end of the day, I don't know what it's like to prepare to play an NBA basketball game, right? So it's it's allowing the athlete to have some sort of autonomy there while also ensuring that they're getting what they need from a training and a rehab perspective, right? So again, if a guy feels better doing nothing pregame, then more often than not, I'm I'm going to succumb to that a little bit and try to affect performance in other ways and make sure that they're recovered and hydrated and feeling good and always checking in with them. But at the end of the day, I think as long as you allow that autonomy while still having your sort of overarching principles for what you want to get done with those guys, and a big part of that is educating the guys on why you're doing what you're doing. Because again, they get asked to do 150 different things by 150 different people on a given day. So having a little bit of empathy for that, but then I think once you build that rapport with the athlete and you educate them in a manner that they sort of understand why you're doing what you're doing, you'll get a little bit more buy-in. So it's like, hey, like pregame, you you look a little bit better on court if we've done some of this ankle activation type stuff prior to you getting out there. Let's make sure that we hit that every game. It'll take 5 minutes. I'm not trying to steal a bunch of your time or whatever the case may be. Same sort of thing on the rehab front. It's like, hey, like after practice, let's come in here and we'll hop on the isokinetic and we'll run through 3 sets of this ankle strengthening stuff, and then I'll get you out of here. So again, it's respecting their time, but also continue to educate them on why you're doing what you're doing to sort of boost performance and make it less about like, oh, like this is just an exercise I like to do. It's for them. So being able to make them understand that is important.
Yeah, yeah. Oh, this also just come through my mind like months ago, like peer, because I sprint a lot
Mm-hmm.
and sprinting, and like usually when I have an ankle sprain, like just like 2 or 3 days, and then I'll be fine.
Mm-hmm.
Nothing's gonna bother me. But like let's say I think it's like 3 months ago since we were talking about like barefoot, all those like corrector exercise. You should have like big toe mobility. You should be able like your big toe should be able to like do abduction, adduction, all those stuff.
Mm-hmm.
And I kind of have like those kind of like messed up feet, right?
Sure.
So I try to do that for a couple weeks, and then all of a sudden, there's one time like I was just sprinting, nothing like I didn't really sprain my ankle, but all of a sudden, just so painful. And there's like 2 months I couldn't do anything, just keep swelling. So that like, yeah, probably shouldn't do that. Like I should just keep doing what I'm supposed to used to. Man, that kind of
Right.
like messed up my ankle.
I mean, I think that's the other part of it too. Is it's understanding everything is relative. So again, the thing is going to be like you need 60 degrees of great toe extension. Okay. Well, some of my guys have 30 to 40, and they don't have foot issues at all. So again, like, am I just going to go start cranking on big toe? Again, it's the continuum piece of it where it's like, okay, we understand there's a deficit there. If there's not performance metric we feel like we're lacking in, or if there's not, some sort of medical pathology, like do I need to start fishing at that kind of stuff? And again, I think there's times and places to sort of to play around with some of that stuff, but again, it's all relative. So again, like if a guy's, as long as it's pretty equal bilateral, I typically don't mess with it other than just general maintenance type stuff. But um, again, it's always understanding. I feel like I've said it a lot, just that continuum of what a foot can look like, or a toe, or an ankle, or whatever the case may be. And again, I think there was a clip of, who was it? It was DeMar DeRozan talking about his ankle stiffness. He's like, I fail every ankle stiffness test. He's like, but I can jump over you and dunk on you. So again, it's understanding that aspect of it as well.
Yeah, yeah. So, uh, outside of like foot and ankle, kind of want to go back to like previously we talked about like load management stuff.
Mm-hmm.
So 82 games. If you go to playoff, there's gonna be more, but like 82 games, every player is like gonna go through a lot. So, and especially now we have like GPS data. I think NBA use connects on, right?
Right. So I think it's in game. Nobody has wearables on, or they're not supposed to anyway. So that GPS data comes from Second Spectrum.
Yeah.
Um, and again, that's league wide. For individual organizations, I think it's really pick and choose whatever GPS system you want. Like we use Connexon. Um, I know there's some teams in the league who use Catapult. There are people who are starting to play with some insole based GPS type stuff like Plantiga. Um, there's Sports Scientia out there. So again, it's that aspect of it's more so just organizational choice. And again, that more often comes down to, if you got a sports scientist like Dan, who you spoke to previously, right? Like he used Connexon at Tech. He's got a good relationship with them. They've always been extremely responsive with what he wants and how he wants to play around with some of that data. So we use Connexon, right? I'm sure if he was a Catapult guy previously, we may have Catapult. So some of that's just based on, I think, organizational preference and practitioner preference.
Cool. So, um, I guess my question is like strength coaches, we look at like probably player load, peak velocity,
Mm-hmm.
how many change of direction, these kind of metrics. Is it gonna change when you go like when you put on your like PT role? Are you gonna look at different metrics that strength coach is gonna look at?
No, I'd say I look at the same stuff. Like, so if I'm entering into a long-term rehab more often, like we'll just go with that, right? Like I speak with our data and analytics people, and I speak with Dan, and I figure out, okay, what is acute chronic workload ratio type stuff. We look at both practice and game loads, because again, more often than not, particularly in season, right? Practice loads dip. They sort of plummet, and again, that's just, you play in 82 games. You can't practice like they probably used to. And then looking at game data, so we're picking max velocity, average velocity, both on ball and off ball. Um, we look at exertions. So again, that's 0 to 100 type stuff. So big acceleration. I'm big on number of decels, and then also trying to pick up number of jumps. Because again, I think Jesse Ellis sort of harped on this at one point when he and I spoke. Basketball is decelerating and jumping. It's decelerating and jumping. So again, like those, particularly in the return to play process, those are your higher force events. So that's where you need to be able to manage them. So again, those are probably the biggest ones I look at in terms of how reliable that data is. I don't know, because of just based on placement of the sensor. And again, I think that's why stuff is trending more towards, sort of that wearable tech that's in the shoe that may pick up a D cell more so than a chip that's placed on a guy's trunks. Because if there's no change or displacement in like the trunk, it may not even pick it up as a jump or a D cell or a change of direction or whatever the case may be, right? So it's understanding that like the data is not perfect, but being data informed better than being data ignorant, I think. So
Yeah.
so making sure that you have those pieces. But for me, again, I'm probably looking at the exact same metrics you are. Um, and then you sort of reverse engineer the return to play process from the end goal, if not trying to shoot to give them a little bit of a buffer on the top end.
Nice. So, before these data and after, before you have access to these data,
Mm-hmm.
after like right now you have all these access to the like these metrics,
Sure.
would it change like the approach of you helping athlete return to play?
Right. So I think again, you have to be measuring something. So again, private practice wise, again, the whole dynamometry thing really came about probably as I was sliding out of private practice. So we didn't have them, and then force plates obviously started to become super affordable again as I sort of jumped in the league. So we didn't have those either. So it was trying to find a way to quantify sort of what we were looking at. I mean, range of motion is easy, right? So you're looking at that kind of stuff with goniometers and that sort of thing. In terms of what we would look at from a strength perspective, ankle wise, was single leg heel raise. Um, Again, both looking for movement quality and movement capacity. So again, more often than not, it was body weight and with a metronome, and that was sort of how we operated on that front. With inversion eversion, again, that's where for me now the Humac norm isokinetic machine has come in super handy because again, that's just a hard thing if you don't have at the very least a handheld dynamometer. If you don't have any of that kind of stuff, you're just like, well, we progressed to a black TheraBand today, and I think I'm pulling with more force than I did last time. And it's understanding that like, yeah, you're losing some info there, but as long as you've got something you're measuring and you're consistent with how you measure it and when you measure it, I think is probably the most important thing. Again, whether you've got the fancy gizmos with GPS and force plates and insoles and dynamometers and that sort of thing, or if you're just in an outpatient clinic and you're doing single leg lateral hop testing, um, whether you're doing pogo variations and sort of you can manipulate your phone and stuff like that to see ground contact time and that sort of thing. So again, there's tons of ways to do it. My biggest thing is just always you need to measure it. You need to measure it the same way, and you need to measure it consistently over time.
Cool, cool, cool. So enough. I'm gonna say enough for the questions about like performance rehab, don't matter
Sure.
those stuff. So this is more of a personal question. Like NBA, the league, it's hectic, super busy.
Uh huh.
How does your family like respond to that?
Sure. Um, Again, 82 games is 82 games. Um, no matter whether you're a West Coast team or an East Coast team, you're going to have some long road trip, right? So for us, we always had that big West Coast swing, one really long and then one probably a little bit shorter. So we had a 14-day one this year and then a 10-day right after All Star break. Um, so in terms of how does my family management? I mean, I have a superstar of a wife, right? So her ability to sort of function independently allows me to do what I do. So obviously super appreciative for that. Um, and it's just understand. I think it helps put stuff in perspective more often than not, especially after I had my daughter last year, right? Like it's stressful. You lose games, you have injuries, or whatever the case may be. But at the end of the day, I like to think that my wife and daughter, and soon to be second daughter, help sort of ground me and sort of put some of that stuff in perspective. Again, I'm not going to sit here and say that I don't care if we win or lose, right? But at the end of the day, I get to go home to them. So for me, if I didn't have that, I think it would be way harder to sort of live this lifestyle because it does give you a mental break. Like at some point, I'll have two children under 2 years old here, so coming home and moping after a loss or because a rehab process isn't going the way I want to. It just isn't sort of an acceptable way to live. And I get to come home and play with my two daughters and give my wife a break. And again, at that point, that's more important than whatever's going on at work.
Nice,
So
nice.
again, I think there's the I keep saying continuum. There's a continuum there, right? Like it's obviously stressful if I'm gone for 2 weeks and there's stuff that needs to be done at the house and that sort of thing. And again, I can't talk enough about how much I appreciate and love my wife for allowing me to sort of do this. But again, the perspective piece is big for me.
Nice. So, also another part of this question would be like dealing with injuries, dealing like it's a basketball game. Someone have to win, someone have to lose.
Mm-hmm.
How to deal with personally, how do you deal with all those stresses and not take those back to your home since like you have kids, you have a wife.
Uh-huh. So again, I played basketball in college, right? Like I like to think that I'm still super duper competitive. Um, and again, me and Dan have talked about it before. It's still hard to lose these games, right? So I think that's why we're in the space. Number one, I think if you just don't care about the winning and losing side of stuff, like probably shouldn't be in this business because again, your whole goal is to affect performance in hopes that it affects winning and
Yeah.
helps franchises sort of progress and stuff like that, right? So it's not so much having this like laissez-faire attitude about win-loss record and stuff like that. It's I think more so for me, it's understanding that like there are only certain things that I can control, right? So for me, that's the rehab process and athletic development management piece of the players that I'm sort of responsible for. Um, Again, hopefully that translates to improved performance on court, which means more wins. But at the end of the day, every now and then you just don't shoot very well one night, right? So it's understanding that I don't necessarily have control over that, and then that as I've been in the league longer, I say longer, I've only been here for 2 years, but again, it's just the reality of it. So being around it more, you sort of find different ways to compartmentalize and deal with it, and not take as much of that stuff home.
Yeah, I got it. I got it. Nice. So that's basically all the question I have for you today. So for those who are interested in what we're talking about today, where can they reach out to you?
Sure. So I'm on Instagram, Dr. John Gardner 23. Um, I'd like to say that's where I put the majority of my content. Obviously, did a lot more of that in the outpatient setting. Had a lot more videos and stuff like that. Again, I'm always getting nudges from mentors and stuff like that to do more in that space. So I don't know how much more I'm going to do with a second child on the way, but we'll see if we can throw some stuff out there a little more frequently. And then I'm on LinkedIn. I tell people all the time I like to think I'm an open book. So again, by all means, reach out. I'll answer whatever questions you got to the best of my ability. So looking forward to connecting with more people in the space. And again, thank you very much for having me on this podcast. It's got more notoriety than I think you realize. So again, a lot of people listen to stuff. So I appreciate the platform to sort of blabber on about my rehab thoughts and stuff like that. So again, thank you for that.
I appreciate you, man.